Hi, this is Darnell. I run a couple of channels on YouTube, or few channels on YouTube that are pretty well known. There's D-Grill, there's Wave Oven Recipes, and there's also Soul Food Cookbook. So that's D-Grill, Wave Oven Recipes, and Soul Food Cookbook are my more popular YouTube channels. But as I announced on a couple of those channels, I had to get surgery for acromegaly, a pituitary gland surgery where they do a scope up the nose into the brain to get a tumor off the pituitary gland. And I wanted to do this video, and I wanted to just basically give some insight into how life is just after the surgery, because I know there are people who are going to have to get the surgery done that have a lot of questions. I've watched plenty of videos that answer a lot of questions, but I haven't seen many videos where someone tries to give a quick take just after the surgery of what you're going to experience going in and immediately coming out. I had my surgery 2 days ago now, and it went very well. Surgery was successful. My tumor was probably about the size of a walnut, and so they had to scoop out as best they could that tumor, and they'll have to in the future see going forward how they want to deal with it based on how the hormone levels respond going forward. But I will say, initially going in, I went to the hospital and got checked in and all, and basically went into the surgery. They told me going in I was going to have a great headache after the surgery, and told me that I might be going to the surgical ICU after surgery, and that I may be in the hospital 2 to 4 days depending on my performance post-surgery. I basically went into the area where they get you all prepped and get the anesthesia and all that good stuff. And so once they gave me the injection that they told me would basically be the point where I would forget everything, and they knocked me out and did the surgery. Didn't remember anything after that, but when I came to post-surgery, they told me the surgery took about 2.5 hours. I, thank God, had no headache. I have had no headache. I'm on my second day post-surgery. I've needed no medication for pain at all, thank God. Lots of people prayed. That's all I can say. Lots of people were praying, and God heard those prayers, is all I can say. So, basically, right after the surgery, they gave me a liquid diet. So, basically I went in the early morning one day, and basically you're not supposed to eat. I wanted to make sure I mentioned it. You're not supposed to eat 8 hours before surgery. So I got a very early morning appointment so I could eat and drink until later the evening. Okay, so sorry I had some visitors come through. So now all the visitors are gone again. So just want to continue where I left off, because I was talking about how you can't eat 8 hours before surgery. So surgery usually is going to be early in the morning. You want to try and arrange an early morning surgery so that basically you can eat before your surgery up until 8 hours before, and so you spend most of that time just sleeping and resting, not setting up hungry. And you can't eat or drink 8 hours before the surgery. So basically when I came to from the surgery that I mentioned earlier, took about 2.5 hours, I was put on a liquid diet. Was on a liquid diet after the surgery until the following morning. So the first morning after surgery, I was still on a liquid diet until later in the morning, maybe about 10 in the morning or so. About 10 in the sorry, about 10 in the morning, they switched me over from the liquid diet to solid food, and so I had my first solid meal about 36 hours after surgery. So since that first day, went into surgery, went on liquid diet, and then liquid diet the following morning. I didn't get solid food for about 36 hours after my last meal. And then after that, with getting the solid food, the energy level went up. Before I was getting solid food, energy level was just low. Couldn't move much out of the bed at all. Also, you know, with the when you first finish the surgery, whenever you move, you'll have blood drainage from the nose. It's kind of like a pseudo blood drainage that you'll have from the nose. And anything you do strenuous will cause that. And you'll be hard to believe what you'll find is strenuous right after the surgery, but just pressing to get yourself out of bed, just pressing to get yourself out of bed can cause enough strain, enough cranial strain to cause some of that drainage to come out. You know, it doesn't take much to try and that cause that strain. And I found that it's best when I get out of bed to just try and use my legs more than my arms. It seems using my arms causes more strain to the cranium than if I try and get out of bed using the leg muscles. So now when I get in and out the bed, I use the leg muscles and I have less drain come out. Now that it's been 2 days, there's almost no drain that I have to dab with tissues or anything. I'm able to kind of usually snort it up a little bit more than having to use tissues for it. But there is still some drain that comes that can, you know, last for a while. They said some places say it can last a week. I'm hoping it ends, you know, sooner than that. I am at a point where I'm not having to really dab as much as I was before with that drainage coming out. So, you know, the solid food's doing well. I'm up. The second day, I've really been walking around a lot. After the first day of surgery, when they moved me, they had me in surgical ICU just after the surgery, and then the following day they moved me to a regular room. Once I moved to a regular room and I was able to walk around yesterday, I did a little walking around yesterday, did more walking around today. So energy's going up, I'm walking more every day. It's good to walk, it's good to talk, because the fluid that's coming down does kind of cause some like phlegm and stuff, and so it's good to keep talking and walk when you can walk to try and keep things moving. So that's basically my assessment after 2 days after surgery, a acromegaly pituitary tumor surgery. So just hope that helps some others, and I will give a future update with how things are going.